I'm here at the Mayo Clinic in Jacksonville, Florida, where I recently had shoulder surgery. The Mayo Clinic has recently been cited as an example in the healthcare debate of a hospital system that really works as it should and has been able to maintain and even hold down costs of procedures and treatments. I started coming to the Mayo Clinic here in Jacksonville almost 20 years ago. When we first started coming down here, only the Davis building back here was here. And since that time, in those 20 years, there has been a spawning of a campus here which involves both laboratories and research facilities, and most recently over to my left, the hospital. Mayo Clinic is an example of excellence in this country and in the world of medical treatment. In my very first trip here, I picked up a book about the Mayo brothers of Rochester, Minnesota. Wanted to read what they had to say about medicine and some of their philosophy. And I learned that the one thing that they wanted to bring was integrated medicine, believing that medicine, the healing of the body and the mind was integrated, that it involved more than one discipline. And the other thing was the application of the scientific method into the discoveries of new ways to treat illnesses. And the other thing that come to my mind was the central interest of the patients themselves. And it's been those characteristics of Mayo that have been handed down through these many decades now, and why this hospital system is recognized as one of the world's very best. One of the things that the Mayo Clinic does that other hospital systems don't do, maybe, and other medical facilities don't do, the physicians here are paid on a salary. So they don't have really any incentive to order more work in terms of a monetary incentive. And that's what's missing throughout much of the country. One of the problems with our system is the fact that we have a hybrid system which uses a third-party payer. Now, when you have a third-party payer, that means that there's blinders actually put into what process actually goes into the cost. One of the things about this healthcare debate has been that we've really, all that I've been able to read and learn from the bills that are both in the House and the Senate, we're not really any great effort to reduce costs. So the third-party system, the third-party payer system, has been a great detriment to the medical system. So medicine is really an honor system, which works okay as long as honor's in place. And maybe that's the one characteristic that stands out better here at Mayo. Maybe in a large part, they passed that test. So it may not be all of the big things, the big dramatic breakthroughs in medicine and science that have come about through this institution. Maybe it's just a lot of little things. And in the end, it's the little things that make the big difference.